I have a nursing riddle for you. Think you can crack it? Here goes. I'm a silent cry within your chest, a warning whispered, not in jest. When stress and strain upon you weigh, I may come to visit, night or day. What am I? Let's unravel the mystery of this riddle with a vital detail that lies within. I'm Abby RN. One of my favorite rotations was when I was in the ER, and that was because you just never know who's going to come through the doors. Patients that always got my heartbeat pumping were the cardiac patients because they were always a challenge. The heart is just amazing in all that it does, but it is complex, which can make it tricky to learn everything you need to know, but not impossible. If you need some help, you can find it at nursing.com/heart. Sometimes, as a nurse, your care is not isolated to just your actual patients. What do I mean by that? I mean that by being a nurse, it means that you watch people more often than a normal person might. You can't help but diagnose or suspect medical issues in people beyond your patient. It's like when you become an RN, something gets activated in your brain, and it's like you have a little bit of hypochondria for other people. You tend to see signs and symptoms in people that aren't your patients. A time when this happened to me was when I was in the ICU treating a patient, and my care ended up going beyond just that patient. It extended to my patient's son. My patient's son had started to say that he felt short of breath and he was having chest pain. All things that might be silent to any onlooker, but noisy warning signs to me, the nurse. He was visiting his mom, so it would have been easy to assume that perhaps he was having anxiety because where they were, and we were in the ICU after all, and she was really sick. But something about it just didn't feel right, and that's where that special nurse brain starts to enter. So I asked him when he started feeling this chest pain, and he said that he's actually been struggling with it for some time. How long do these episodes last?
Couple of hours.
What does the pain feel like?
Feels like an elephant sitting on my chest. If I were to rate it, I'd say 10 out of 10.
Have you noticed this happening after you do a certain task, or do you take anything to make it feel better?
Well, I'm a smoker, so I usually chalk it up to smoker's lungs. Typically, the pain's worse after exertion, like going upstairs. But again, I thought it was just because I smoke, and I haven't taken anything for it. It usually goes away after a second, but this pain is something else. It feels like way more pressure than normal.
Do you feel pain anywhere else, or just in your chest?
No, my left arm hurts too. Am I having a heart attack?
I'm not sure quite yet, but I definitely think that we need to get you admitted and checked out. As it turned out, we hurried and hooked him up to the EKG, and he was actually having an MI, a myocardial infarction, while visiting his mother in the ICU. This was a case of untreated angina that we were dealing with that led to an MI. Did you catch that from the symptoms and solve the riddle at the beginning? I put a link in the description below for a quick practice quiz you can take on angina to see your current level of understanding. Go ahead, I'll wait. How did you do? Let me know what you scored in the comments below. Okay, so let's dissect this. Angina is a type of chest pain caused by ischemia, or lack of oxygen, that starts from the heart. This is important because there are patients that report chest pain for all sorts of different reasons. There could be issues with other structures in the chest, like the pleural tissue surrounding the lungs or pericardial sac, which surrounds the heart. Even during an anxiety attack, there can be a manifestation of major chest pain. But with angina, the pain specifically starts at the heart because for one reason or another, those coronary arteries, the vessels which provide oxygenated blood to the heart tissue itself and allow it to function properly, are becoming blocked. The blood supply to the heart muscle is insufficient. It's a reduction of oxygenated blood flow, which is ischemia, to the heart, and it causes anginal chest pain. All that being said, angina is a vital symptom of a bigger underlying issue. We can say this because if perfusion is not taking place correctly in the heart, then we know that if it starts to fail, perfusion to the rest of the body is at risk too. This is why it's so important to listen to this symptom, because it's telling us the heart is starving of oxygen. It must be readily addressed and treated before something worse develops, like my patient's son, an MI. Angina is a common condition that you may deal with while working as an RN. Let me share with you what helped me. I'll show you what I did on nursing.com to master angina. I included a link to the lesson on angina in the description below, where you can spend some time reviewing it at your own pace. I stressed about my understanding, passing my classes, and ultimately passing the NCLEX. I found success when I started using nursing.com because it helped me find the must-know information with clear and concise lesson videos, and then I would check my knowledge with the lesson quizzes. I used NCLEX to not only evaluate if I was ready for the NCLEX, but it would also give me personalized suggestions on what I should study to fill in my knowledge gaps. I could focus on those topics further with custom quizzes and use the additional study tools that are adapted to my personal learning style. I hope this has helped you understand angina a little bit better so you know what to look out for with your patients. Now, I'm rooting for you. We're all rooting for you. So go out and be your best self today, and as always, happy nursing.